Hello, everyone. It's Dr. Nirav Pandya. A lot of Golden State Warriors fans have questions about Andrew Wiggins' adductor injury. Here's a quick breakdown of the injury itself and what we look for in terms of return to play timeline. The first important thing to understand is that when an athlete has hip or groin pain, there are a couple of different things that we think about. Number one, you worry about an injury to the adductor muscle, which is basically your common groin pull. Number two, you worry about a sports hernia. Number three, you worry about issues with the hip joint itself in terms of the cartilage, the labrum, or other ligaments around the hip joint. And number four, you worry about injuries to other muscles, such as the hip flexor. Now, the adductor muscle is the most common muscle that's injured in a quote-unquote groin pull. The adductor muscles run on the inside part of the thigh, and they help to bring the leg inwards towards the body. This is in contrast to abductor muscle injuries, which are on the outside part of the leg, and they basically help to bring the leg outward away from the body. Now, the adductor muscles insert on the inside part of the pelvis in this general region right over here. That's a reason why they cause groin pain. Now, if you think of this muscle injury, it's important to think of it just like any other muscle injury. The return to play depends on where in the muscle the injury actually occurs. If it's closer to the tendon, it can be a little bit worse. If it's more in the muscle, it can return, can be a little bit quicker. These are usually graded grade 1 for a microscopic tear, grade 2 for a partial tear, and grade 3 for a complete tear. Now, the reason why the adductor muscles are important is that they help to stabilize the hip, and you need good hip stability to make sure you don't injure your knee, your ankle, and can be effective in terms of cutting and pivoting activities. Now, if you look at NBA players who suffer this historically, in general, they miss about 7 to 8 games or more or less 2 weeks. The important thing to understand is that there is a high risk of re-injury if these athletes are not allowed to recover appropriately. But if you look at their long-term prognosis, NBA players who have this injury have no impact on the performance once they've returned and healed very well. But it's important to get this injury to heal because it's very important to have stability in the hip and in this area to play basketball effectively. Thank you.